Hi there.
Hello, I have a hearing impairment. I'm here to see Dr. Muir.
Okay. What's your surname?
Trim?
And your first name?
Peter? Over here?
Just over there, it's fine.
The Code of Health and Disability Services Consumers' Rights guarantees in law a patient or client's rights when receiving a health or disability service. This DVD focuses on 4 of the consumers' rights that are most relevant to working with deaf and hearing impaired patients and clients, and how you, as a health professional, can ensure these rights are protected. Respect, dignity and independence, communication, information. When working with deaf and hearing impaired clients, it is important that health professionals take steps to ensure clear two-way communication. This DVD shows how to communicate with deaf people through a sign language interpreter, and how to talk effectively with hearing impaired clients. This helps to ensure clients are able to make informed decisions. Communicating effectively with deaf clients also shows respect for their cultural needs as deaf people who use sign language as their preferred mode of communication. And who view their deafness as a positive part of their identity rather than a problem that needs to be fixed.
Hi Peter, time to come through.
Scenario 1, Peter. Both medical and admin staff need to know how to communicate with deaf and hearing impaired clients. This includes using texting, email, fax, or relay phone calls to set up appointments. Staff need to know how to book and work with interpreters. Staff also need to know how to get clients' attention, such as by waving or tapping them on the shoulder. A note on clients' files can help ensure effective communication for each visit. When working with hearing impaired clients, eliminate background noise so that they can use their residual hearing. Close doors and windows and turn off background music. Make sure lighting is sufficient for lip reading. Look directly at hearing impaired people when speaking and do not speak while looking down or away. Lip reading is difficult and requires clear speech. Be willing to repeat or rephrase statements to ensure understanding.
I'm Dr. Muir.
Morning.
How can I help you today?
I'm just feeling a bit down in the dumps at the moment. I mean, I know there's not a lot you can do about my hearing, but it's really hard listening and not sleeping well. And I'm hearing as well as I can, but it's a case of, is there any way I can get out of this depression?
Now Peter, I just want to make some notes on the computer.
Yep.
So you okay with that? And do you need any help with your lip reading or aids?
No, as long as people like you are talking and facing me and I can see your lips and the way you're using your mouth, it's usually okay, and you speak quite clearly. But when people turn away or mumble, that's really hard, and I can get quite frustrated. And do you know counsellors who are used to dealing with people with hearing problems?
Scenario 2. Rachel. Deaf people who use sign language as their preferred means of communication have the right to have interpreters for appointments for themselves or about their hearing children or dependents. Qualified interpreters are trained in accurately conveying information between English and New Zealand Sign Language, without adding, omitting, or changing any information. Interpreters who are members of a professional body are also bound to a code of ethics, including impartiality and confidentiality. Children, friends, and family members should not be used to interpret, as they have not been trained as interpreters and may not relay information accurately or impartially. When showing something, pause to allow time for the deaf patient to watch the interpreter for the explanation. Do not speak at the same time as demonstrating, or important information may be missed.
Good morning. My name is Bert. How can I help you today?
Hi, this is my son Jared, and I don't think he's very well. I think he has some problems with his breathing.
Okay. Hi, Jared. My name is Bert. Pleased to meet you. How old are you?
6.
And Jared, what is your favourite sport?
Soccer.
Cool. What happens when you play soccer?
It hurts my chest.
Okay. What I'd like you to do is just to take nice deep breaths in and out through your mouth. Okay? We'll just put this into the front underneath your t-shirt. Okay, Jared. Goes into the back of the spacer. For the first time that you use the spacer, you need to put 10 puffs of the medication into the
10 times?
spacer. Correct. Do you want to have a look at this, Jared? That's where you breathe through.
Scenario 3. Ronald. Deaf patients may take longer to describe problems, using a more detailed narrative approach than hearing patients. This is a cultural difference. Deaf patients' background knowledge about health, illness and treatments may be limited due to difficulties in accessing information that is readily available to hearing people. Deaf patients may nod even when they do not understand. This is a cultural face-saving strategy. It can be worth asking questions or asking the patient to repeat instructions to check for understanding. The patient may have a preference for a particular interpreter, for instance, a male or female interpreter for sensitive exams. Where possible, these preferences should be respected. The interpreter can be present during a physical exam if the patient agrees or requests this. Another option is for the exam procedure to be explained beforehand and for the interpreter to leave the room during the exam. The doctor may need to spell or explain medical terms for the interpreter or the patient. If the interpreter needs clarification from either the deaf or the hearing parties, they will ask for this.
Good morning.
How are you today?
Oh, I'm all right. I'm good.
Good.
But I've got a bit of pain. Yeah.
Okay.
Just down there. It's like I got up and it just felt a little bit different. They didn't sort of feel, even when I was walking, I mean, initially I started, like I went to go wash my face and stuff like that, and I had trouble walking, and then I had a look and there was something there. I'm not sure how it happened. I started the last couple of days anyway. So I got kids something to eat and stuff like that. And the pain sort of was always still there, was constant. And I thought I'd best go see a doctor about it anyway, so to get it checked out. It just doesn't feel like I'm 100% at the moment. It just feels quite bad. I mean, being deaf, I can't use the telephone, can't text very well as well, so I thought it's best that I need to go see a doctor to find out exactly what's going on here.
I need to have a look, please.
Yep, okay.
So what I need to ask you to do is I need to ask you to slip your jeans off and come and stand over here and pop up on the bed and I'll have a look. Would you like this
I'll need the interpreter, yes.
You'd like the interpreter to stay while I examine you?
Yes, that's fine.
Okay, thank you. I'll just ask you to move over here then, thanks.
Okay.
Ron, I'm just going to have a look at the sore place and see what's going on. Thank you. I'll lift up the sheet.
Yep.
Right, and is it sore when I press in here?
Yes, that's it. Yeah, it's pretty sore there.
Yes, I see what the problem is. Thank you. So, Ron, what you've got on your leg is what we call a boil.
Oh, right, yep, okay.
Which is an infection of the skin.
So, sorry, excuse me, what do you mean? What's an infection? What do you mean? I don't understand that word.
An infection is where you have a germ that gets in under the skin and causes it to get red and sore and swollen.
Oh, right, I get it, okay.
Yep.
So that infection, like the medication you give me, that'll help sort of make that better?
Yes, we treat you an antibiotic to clear up the infection. It's called flucloxacillin.
Okay, right, yeah.
Would you like me to write that down for you?
Yep, okay, if you want to. Yep. That's a pretty long word. Wow.
It is a long word.
Oh, great. Okay, having it written down is good. It's going to be help as well. Yeah. I think it's quite good for me. So, like, when I go to the chemist and stuff like that, I can sort of see it as well. Help me remember the name. That's great. I understand it. Great. Thanks for that.
And you need to take that 1-3 times a day, please.
Scenario 4. Hayley. When talking with deaf clients through an interpreter, speak directly to the deaf person and not to the interpreter. The interpreter will usually sit next to the hearing person so the deaf person can see both the speaker and the interpreter. Before approaching and touching a deaf patient, explain what will be done and allow time for this information to be interpreted. Be aware that culturally deaf patients may not see being deaf as a medical condition that needs to be fixed. When referring deaf patients to other practitioners or specialists, indicate that an interpreter will be required.
Dr. Muir, I see you brought a friend today.
Yes, this is my interpreter. Just speak directly to me and she'll translate for us.
Great. Great. Hayley, how can I help today?
I have a problem with my ear, an infection or something. It had started a few weeks ago. I just don't feel well. I have a hearing aid and my left ear is fine. It's my right ear that has the problem.
So what symptoms have you been noticing? Okay. So I'll just have a wee look in your ear.
Okay, yes please.
Okay, Hayley, I've examined your ear. I'm not sure. Okay. Have you ever thought of implants or updating your aids?
No, thank you. I have a hearing aid, but I wouldn't like a cochlear implant. Thank you.
Okay. So I'm going to make a phone call to your specialist now. Now, just checking, you will need an interpreter at that appointment. Okay, Hayley. Yep. Oh, hi there. It's Dr. Muir here. I'm just ringing up to make an appointment for Hayley. She is deaf and she will need an interpreter. Can you please arrange this? Thanks. Go. I'll pass that on to Hayley. Bye.